Here we go.
Oh, wow. It's always her.
Yes. Yeah.
Got another blooper.
Ladies and gentlemen, welcome back for another episode of the Aesthetic Agenda here in the home of the, what am I saying? Oh, no.
Can't talk.
Yeah, here in the lovely Rediscover Aesthetic Studio. Hi, everybody.
Hi.
How are y'all doing?
Fantastic, since I got my immunity IV infusion yesterday.
So for the lovely people that are seeing us right now, you can notice that Amber and I are hooked up to a little bit of a device. You can notice here on my arm. We're trying out our own supply here. We're doing a little IV therapy. Amber wasn't feeling too well yesterday.
Oh, since last Friday, it's been pretty bad.
So she got the funk, and now we're trying to get her over the funk. And I, for one, can't just, pass up a good chance at another IV. So here I am.
Yours is for energy.
Energy and focus.
Weekend with the kids.
God bless me. So my lovely wife, Katherine, say hello.
Hello.
Catherine's leaving me on Friday, maybe for good. She might come back.
She ain't leaving me, that's for sure.
So you might have to go with her.
I just know she's coming back. I might escape to Scottsdale indefinitely.
And she might stay there.
I think that's where I'm going. I don't even know.
I'm dying to play golf in Scottsdale.
Oh, you said Phoenix.
I fly into Phoenix. Is Scottsdale by Phoenix?
Pretty close.
Yeah, then we're going to Scottsdale.
It's pretty darn close.
Yeah.
Cool. See, I'm jealous because even in Arizona, it's an arid desert, but they have two of my most favorite things. They have golf and they have good hockey.
Okay.
Yeah, there we go. All right, so let's talk about this ID stuff that we're getting here. Amber, what you hooked up to?
I'm hooked up to the immunity, one of the 3 that we offer.
So I'll tell you what, I haven't personally gotten the immunity bag yet, but we've given it to 2 of our patients in the last couple of days.
3.
And I personally witnessed my wife getting one. And I mean, when I tell you she looked like she had a foot in the grave yesterday, she looked ill.
I felt ill.
She looked ill. She's not a very nice person when she's ill.
She was very nice. Pretty nice.
Okay.
Y'all, don't
I'm just
from y'all's
I just can't contribute anything.
Oh, yeah. when she's sick, when she doesn't answer her phone or anything to do with.
No. And this woman was not.
I haven't done laundry. I haven't done dishes.
But she's watched a lot of Netflix now.
Well, what else am I going to do?
Your girl's got her Netflix down. I think she watched like 3 seasons of
Supergirl. That's what I'm on right now.
Supergirl. I'm glad you're watching something in actual English.
And here I was desperate to just get her better so she didn't leave me stranded at work by myself anymore.
Right? Yeah. Ouch. Burn.
Me yesterday.
I know. I had to leave and pick up my daughter because she's sick too.
I kind of made you leave. I was like, go.
Yeah, you did. Anyway, this immunity IV, not only does it help with dehydration when you get sick, your increased metabolism, so you're burning more fluids, which a lot of your symptoms are derived from that, but it's also stacked with vitamins.
B vitamins, vitamin C, and zinc.
Yep. And I'll tell you what, man, I mean, you wouldn't have known you were sick.
No.
You woke up this morning and I remember rolling over and I'm looking at you. I'm like, how you feeling? You got to smile and you're like, yeah. Like, hell yeah, you're back.
I know one of our patients told me that was the best medicine you could have got.
Right? And he has a high demand job and sure enough, he popped right back.
So that's probably what made him jump back quickly.
I love it.
Yeah, so it helps protect you against any bacteria, viruses that are coming, but also helps you recover faster if you're already sick, like I was.
I am a big fan.
Yeah.
I love it.
So Arden, tell us about your IV.
I don't know what's in my IV. I can't even see the label.
Get Up and Go is yours.
So Get Up and Go has another mix of blend of vitamins and minerals that's going to
acids.
Help you regain a little bit of focus. It's going to help boost your energy levels a little bit. And just by getting the fluids in and of itself, it's going to help you feel better, more focused and more concentrated. Your brain's able to work a little bit better.
It's more of a recovery IV, kind of get you back on track.
Yeah.
So after a good workout or, really just fatigued all week and just need a little boost.
Now, a cool stat is that over 80% of Americans are chronically dehydrated.
Yeah.
I talk about this a lot with my patients. I'm saying, if you want your aesthetic results to look better, drink more water. And not only just water, but electrolyte-rich water. So a lot of people can get in trouble when they start to pound fluids and they don't replenish the electrolytes too. You can start getting chemical imbalances, sodium imbalances. It's called hyponatremia. if someone's ever pounded a bunch of water after working out and they got a bad headache or whatnot, that could be from a sodium deficiency.
Which can cause confusion.
It's bad. I mean, it kills people like when you're not doing it right. So, electrolyte rich fluids are very important too. So my rule of thumb is, if you're sitting in an air conditioned box all day and you're not working out, you probably need at least 100 ounces of water just to maintain a good level of hydration.
Yeah, people don't realize how much just a bag of fluids will make you feel. Like you just really don't understand how much you're run down.
Yep.
Until you get that bag of fluid and you're like, oh my gosh, like I feel like a whole new person.
And it's 100% absorption because it's going right to your veins.
Correct.
Whereas I think if you take vitamins, it's only 20% of the whole body. It's like nothing.
If you're lucky. I mean, the acid in your stomach can break down a nail.
Yeah.
So just imagine some of those little capsules. Our lab director that we use, he's very famous for saying that he has the most expensive urine on planet Earth because he takes a lot of these oral supplements and your body just destroys them in the stomach. So
I don't see how he does that because I can barely stand to take 3 vitamins in the morning.
I'm telling you. So get your IVs, people. I'm a big fan.
Huge fan.
So we're going to let this run for a little bit and, replenish all of the stuff that we've lost. And what else are we talking about today, ladies? I hear we have an action-packed show talking about some semaglutide myths.
Semaglutide weight loss, yes.
And it kind of runs together with this because, it's important to drink all your water with semaglutide and get your fluids in. And
so we're going to go over a bunch of things with semaglutide that, frankly, just really piss me off. I am so tired of opening social media and seeing all the negative press and all the negative bashing on this stuff. Semaglutide is an incredibly safe medication. It's derived on technology that's been around for decades. And if people would just do the right thing, we wouldn't have any problems with this stuff. So what do we have? We have a list of, y'all printed something out. We're going to talk about some stuff.
Yeah, I mean, speaking it. And it's not false. I had a patient come in the other day who literally, she was interested in the semaglutide and she was like, do y'all sell that false stuff? And I'm like, you mean the compounded stuff?
False?
It's not false. It works. Obviously, if it didn't work, you wouldn't be in here asking me for it or asking for information about it.
So you got the
false stuff? I got that fake stuff. It was fake stuff. But
that's funny.
And I was like, no, ma'am, we have the compounded stuff, but it's absolutely real, 100% real. And I have great results from it. So
people are ridiculous, man.
Loosely.
People got that stuff.
We sell the pellet. We say the fixed.
No
all
fake
branded here.
Yeah, no fixed.
When I think of fake stuff, now listen, there are people in this industry that sell fake stuff.
Oh, yeah.
There are people in this industry.
You don't know what they say.
Oh, yeah, right? So let me give you all a little tip out there. If you're listening or watching out there, if you see a special for Botox that's $5 a unit,
run
in the opposite direction. The stuff's not real. So you can add semaglutide to that. Yeah, we've run specials. We've run one special around Christmas time where we did $99 for the first month, which when you compare it to the retail price of Ozempic or Wegovy or anything like that, shoot, I've seen some pharmacies charge $1,200-$1,400 for a month's supply of that stuff.
Yep.
Which is outrageous. I mean, it's robbery. It's absolute robbery.
Well, that's what the pharmaceutical companies are charging if it's not covered by your insurance.
Correct.
How they're thinking they can get away with it. If you're going to be willing to pay that much from the pharmaceuticals, why can't I charge that?
So if I was a layperson and I saw CVS charging $1,200 for this, and then I saw Rediscover Aesthetics charging $99 for the first month, I could get a little questionable.
Yeah.
I could see that. But then once you realize what's really going on here, you can see the plan. Now, all that to be said, if they're offering it for an insanely low price for an insanely long period of time, you got a question. I'll tell you exactly where I get my stuff. I'll show you the receipts. Our stuff is made from a legitimate compounding pharmacy. It goes through more regulatory updates and monitoring than any of the big pharmaceutical companies. That's for darn sure. And so I feel comfortable giving it to my patients. What do y'all have to add?
I'll say that I won't lie. I'm going to be 100% transparent here. When I first heard about the semaglutide, I had when I was in clinicals, finishing my last rotation, I was with a provider who didn't prescribe it the way it should be. And so I was ruined on it. I really did think it was the, people oh, they're cheating their way to, weight loss. Like, man, that's not fair. Like, why can't they just lose weight? Like, why can't they just go work out and diet like normal people? Like, that's not fair.
That's a lot of the hate that I see on.
Yeah.
Yes, and it bugs me now. It really does when people are like, oh, that's cheating. That's not. And I'm like, no, now that I know more about it, I'm educated on it, and I know the benefits of it, the risk. Like, now I know when it's done the proper way, it has very good effects. Like, there are some people, like, especially learning more about the hormones of people too. Some people just can't lose weight with, a diet and exercise. We have one right now who literally came to me in tears and was like, I work out 6 days a week. I run triathlons and Ironmans, and I look at food and I gain weight. And I'm like, okay, well, let's try it. Like, that's the people that should be on it. And I just, like, people that need to lose weight for a wedding in 2 weeks or, whatever they want. Yeah, I'm not okay with that. But
those are the people that end up in the hospital from
yes, they're not using it correctly. They're just getting it because they can. Like, they think, oh, I just need to lose this for cruise or, wedding and all this stuff. And I'm like, that's the people that, really got under my skin with it. And I got a bad vibe from it at first. But now it's like one of my favorite things because, like, when you can help these people that truly are doing everything they can and are being accountable for, working out and changing their lifestyle factors, it really does have a good effect on them. I mean, like, and seeing them happy and seeing them healthy, it matters.
So semaglutide, I mentioned earlier that it's based on technology that's been around a long time. Semaglutide is from a family of medications called peptides. And it's hard to really call peptides medications even, right? Because they mimic what's naturally occurring in the body, right? So peptides are single chain amino acids, and they replicate something that's already naturally occurring in the human system. There are hundreds, if not thousands, of different peptides that are out and available and on the market. Some are used, some are not. I think semaglutide's getting a lot of heat because most people in the general public didn't know what peptides were before a year ago. But if you have, the letters and names like BPC 157 and TB 500, and you hear about Semorelin and Ipramorelin, and all of these are peptides that have been around for decades. And we have really good evidence to support their efficacy. And they're incredibly safe because they mimic something that happens in real life. The problem is just like what you talked about, Amber. When you start getting greedy and you start getting
incorrectly and
you want to go from 0 to 100, that's when people get in trouble. That would happen with anything. That would happen with Tylenol. Like, have you seen Tylenol toxicity? Like that ish ain't.
It's worse is getting that antidote for it.
Yeah,
Ugh.
it's awful. Like,
smells awful.
What? Kat,
it's vitamins.
Kat, give me your sense. I want to hear what you got to say.
My sense. Yeah, I mean, we did semaglutide together last year.
Sure did.
And it was amazing. So I just had, it's good for that mom that has that stubborn baby weight that won't come off no matter what you do. And so that was me. So I took it and I lost about 35-ish pounds over a few months. What I like about it is that, well, it suppresses your appetite, but it takes the emotion out of eating.
Yes.
So, we all know we live in the South too, so everything is about food.
Do we?
So
especially right
we're
now.
always thinking about our next meal. Okay, what are we going to eat? When can we eat again? Okay, what snack do I want? Oh, I'm bored. Let me just eat. I was never really well, I guess I am an emotional eater. I'm a bored eater. I don't eat when I'm like sad or happy, but if I'm bored, I'll eat. I don't know, I guess just to do something with my hands. And then, but when I was on the semaglutide, like I didn't,
It cuts down your
my every thought wasn't about food, and it took the cravings away too. So, if we were going to, I don't know, Keith Young Steakhouse or whatever, like I love steak, but I was excited to go and I enjoyed my steak, but I don't know, about 5 bites in, I'm like, okay, well, I'm satisfied. I'm full. I don't need to keep eating more. And before it was like, oh, this is so good. I just need to keep eating because it's so delicious. And then you're over full.
Yeah, I feel like it helps really a lot with portion control.
Yeah.
It's a hard thing to do down here in the
Yeah.
South.
And my big thing was portion control. I could eat like 2.5 portions of something before.
Right.
And then this, when I was on the semaglutide, it was, I'd eat half of a meal and be completely satisfied and be okay stopping. And then I'd save the rest for later.
So that brings me to my point with how we do our consults, because one of the big myths that we see with semaglutide is, well, I'm just going to gain all the weight back when I stop. Well, yeah, you might, but what diet do you know that exists that you're not going to gain weight if you stop doing said diet?
None.
What's so complicated about that? Why is that even a myth? Why is that even a thing?
Well, and, the more I've been reading about it and researching, if just say your norm is 200 pounds, just say your baseline weight is 200 pounds, and you've been that for years and years. You get on semaglutide and you lose 30 pounds. So you're at what, 170 now?
That's correct.
So you stop it. Well, now, your brain now doesn't have the semaglutide and it starts, kicking back in. Well, your brain is going back to trying to feed a 200-pound body, not a 170-pound body. So, yeah, you're probably going to, end up gaining some weight back. But that's why you have to train yourself before that and implement lifestyle changes, because your body, you don't want to sustain at 200. Now you want to sustain at 170, but that's not what your body's been used to the last 5.
Because you think that you can't survive on just like half of a meal or half of a steak, because that's not what you're hungrier.
Right.
I'm going to partially disagree with you. And I'm going to say that your body's not trying to feed a 200-pound person when you're 170 pounds. It's not how it works. But what does happen, and this is an absolute fact, the foods in America today, in today's world, are designed to make you addicted to them. They are, unless it's completely authentic, raw, natural food that God created, the food is designed to make you hooked to it. It's worse than heroin. It's a drug. So if you don't create the mindset while you're on semaglutide to say, hey, I can live on a third of what I normally eat, or hey, I'm going to make these food choices and be happy and content with them, then you're going to end up right back where you started.
I think that's what she was trying to say, honestly. Yeah. I got her. I was that's
Thank you.
I mean,
Amber always understands what I'm trying to say.
because she explained exactly kind of how I would explained it. I'm sorry, we don't have the scientific.
We talk real world.
Is that what it is?
In real world words.
The kindergarten.
You talk in that scientific, with those scientific words.
Time. We got to chill with that.
Some people can't follow that.
We were able to add just now. That is plus
I mean, we're right.
track on the.
One of the two, right? Okay, so that was using the word mindset is too big a word after 2 p.m.
I think we said the same thing in 2 different ways.
She did exactly. I got. Because I'm in the middle of mediating here. That is exactly what.
Gotta give Amber a gavel.
I'm kind of scared. I really don't show this out right here.
Okay, so.
And then another thing.
Oh, tell us another thing.
You've always said this over the years.
We'll just tell you a different way. Hold on.
He will, I'm sure. Food, you're supposed to eat to, correct me if I'm wrong.
He will.
Eat to live, not live to eat.
There you go.
Okay. So with the before, we all lived to eat. I mean,
Correct.
we're from Louisiana. I love our crawfish, and it is king cake season. And that's my weak point right
I have
there.
2 pieces of king cake.
I don't.
24.
I can go without sweets my whole life, but put a king cake in front of me, I will devour it. Not grocery store king cake.
Oh no, it has to be like the New Orleans
House or Mandeville Bake Shop. But anyways, so before you lived to eat. Now with the semaglutide, you're just eating to live, which is kind of what I said earlier about taking the emotion out of eating. Yep. You're just eating to live, which is how it's supposed to be.
And I feel like that's sustainable even after you get off of semaglutide, which is my ultimate goal. Like, do I think semaglutide is safe to stay on for a long time? Yeah, yes. I do. We'll see. We'll watch the studies 10 years.
Not at the high dosing, but you wean yourself down.
Look, there's going to be diabetics that are on 2.5 milligrams for the rest of their life.
Diabetics, yes. But for people just for weight loss like us, we don't need 1+ milligram for the rest of our lives. But I think you wean yourself down to a dose that you can sustain your habits and keep your cravings down and maintain your weight. And so I've been off of the semaglutide for a year now, Every now and then I'll give myself a little booster. It's not consistent though.
Right.
We all know I'm bad with consistency. But I
Well,
think I've only gained like 5 pounds back over the course of a year.
Yeah. And you're really not, I mean, I'm going to call you out. You're really not watching what you eat. Like you're eating.
Yeah.
Oh, I was about to say that too. Like people that are on this drug, I mean, not drug, listen, said, okay, medication. Let me get this right. Or people take this out of context.
The haters coming out.
You can't just take it and eat taco every day.
No.
Life. I'm sorry. Or McDonald's and expect to lose.
And I don't do that.
I know some
Yep.
few that do. Okay. So it is not a miracle drug. It is a, addition to lifestyle changes. Like it's not,
I will say this too. This is a way that we differ from, say, our competitors or colleagues that are offering medical weight loss like semaglutide. We are going to bring you in and we're going to do a consult in our office.
And it's an hour long. We're thorough with it.
And we talk about all of these mindset things. And we give you a weight loss journal. We tell you to document your food. We do all this stuff. But we're also going to give you your shots every week. Most people don't. Most people are giving you your syringes and walking you out the door. See you later. Good luck. And we're taking personal accountability with you, walking you through this journey every week. Now, maybe you get to the point where you graduate and you don't need to do it every week. We could talk about that. That's fine. We could bring you, then we can send you home.
A lot
with
of
some
tools
stuff.
in our toolbox to.
Yeah. But we're going to keep you personally accountable for this. We're going to make sure that you're going to lose the weight no matter what. I mean, you can go home and eat Oreos and Taco Bell and you're going to lose weight.
I'm not dosing you a week, that's for sure.
No. And
Because I know what you did.
And that person will end up right back where they started 3 months after they got off because they're not changing their mindset.
Y'all know me, I don't hold back, so my people are on.
Right? You crack the whip on them. I've seen it.
But look, some of my most successful people are, hey, they're doing great. They're losing pants size left and right. But I'll tell you straight up exactly what we expect from you. That not everybody's the same. You may lose 4 pounds in the first week, but don't think that's going to happen every week.
I tell my patients 1 to 3 pounds per week.
A few people that I started out though are like 4 to 6 in that first week. And whoa, hold on, like don't get too excited here.
Right.
But just know as we go on. But I don't dose them up unless I know that they're like being accountable for working out. But if you want to just keep going up and you're not working out, you're not changing anything about it. Nope, we gonna start over from ground zero again. Why should I move you up or give you a pass when you're not doing anything to help yourself out?
Absolutely. Absolutely. I'll say this too. Another thing that we do with our semaglutide patients that's different than our other colleagues, and I think this is one of our best assets, really, if you think about it. Our facility is inside a gigantic, beautiful fitness center.
I was just about to say that.
We're in Franco's. So we're in a health club. This health club has every single modality and exercise program that you could possibly conceive.
Yep.
And so what I've started to do this year, which it's a shame that I haven't been doing this all along, but look, I'm catching up to myself. Every consult I'm doing, I'm walking them down to the personal trainer's desk. I'm be like, hey, sign this person up. Let's get them on a resistance training program, because another myth about semaglutide is that, I don't need to work out. Baloney. You need to work out. This stuff will make you lose weight, but it also will, if you don't pay attention to this, it'll start to demineralize some of your bone density. It'll take away some of your bone density. It'll take away some of your muscle tissue. So
To clarify, that's with any weight loss medication or diet where you lose weight that fast. It's
Correct.
not the semaglutide doing that. It's
Correct.
the rapid weight loss doing that.
Right. And sedentaryism as a whole, right?
Yeah.
If you're not working out, if you don't use it, you lose it.
Right. What? Somebody's phone vibrating or something?
It's mine.
Oh.
That's okay. I'll have to cut this
The
out.
ice cream makers.
I forgot y'all don't have headphones.
Oh.
There it goes. I thought I put my phone on. Whatever. If you don't use it, you lose it. So you have to do resistance training. I don't care. I tell my patients this every day. I don't care if it's push-ups by your bedside or if it's a formal personal training program. If you need the accountability, we got you, right? Let's get you a Franco's membership. Let's get you a personal training deck and get rolling.
They have personal trainers. You can work out on your own, and they have really awesome group classes too.
Yeah.
And that's another thing too, like while we're on this subject, like I tell a lot of my patients, don't get fixated on like the pounds, the numbers, just like anything with vitals, anything like that. When you get fixated on that, muscle weighs more than fat. If you're working out, you're doing resistance training, you're going to gain muscle. Your pounds aren't going to go, skyrocketing down, or, you're not going to lose a lot more than you think. But you're losing the pant size.
Yep.
You're losing the inches. You can see a difference.
Yeah. You're going to start feeling better.
Yeah. Just because you can't see it on the scale, well, oh well.
The scale is a very
Mind.
important. It's not a good tool to dictate weight loss.
Terrible for your mental health.
Can be.
But I'm glad you brought that up, because yes, it's not a good weight loss tool, but it's the only one we have. And it's an objective measurement. It's an objective tool that you can use every single day. So when we're doing that consult, I tell that to my patient, look, get over the fear of the scale. Get over it. Like, that's why I'm weighing them every day, or I'm telling them to weigh themselves every day, and write it down. Just get used to it. Forget about the number. I don't care what the number says, because it's like you said, we're going to measure this in how your pants fit. We're going to measure this in how you feel.
Exactly. That's my biggest thing is I'm like, how do you feel overall? Are you more, are you tired still? Are you, you have more energy? Like, and that's another thing too. We do give the B12 shot with it. So,
Yep.
That really helps and kind of makes us.
Yeah, it helps curb symptoms and gives you a little energy.
Because I've heard a lot of people say semaglutide makes you fatigued.
So that makes sense because you're eating a lot less and food gives you energy. So you need to remember to eat and eat, high protein, like good calories to fuel your body. Or else, you're going to be fatigued because you're eating about a third of what you normally eat.
I'll talk about diet in a second, but one more thing about the scale. It goes back to that mindset. You're doing something that makes you uncomfortable, but by doing it every day, you make it less uncomfortable, and you get more used to it. One thing that a scale is good for is that it measures trends. So, a pound or two here and there, I don't care. In fact, I'll tell my patients often that if I weigh myself in the morning and I weigh myself in the evening, I might have gained 8 pounds.
Yeah.
Right?
Well, that's what when too, like when they come in, I'm like, okay, what did your scale say this morning? And I'll chart that, because as long as they're seeing a trend going down, like who cares what my scale says?
Yep.
I mean, everybody's scale is different and calibrate's different. And so like, as long as they're seeing, decrease in their scale and stuff like that, that's, I chart both. So.
Yep. So pro tip for you out there, if you're on this stuff, weigh yourself every day, but do it at the same time. Do it in the same kind of format, right? So if you're just getting out of the shower and you're in your birthday suit, like do it naked. If you're wearing shoes, wear shoes every time. Like do it the same every time and eliminate all those extra variables. That way you can get a decent representation of where you're at, and then just watch the trends, right? So if your weight's gone up 3 pounds over the course of a week or 2 weeks or 3 weeks, that's when the scale becomes relevant. Otherwise, I don't care. Diet. Ooh, diet. I could sit here and make 10 podcasts about diet alone, because there's so much garbage out there. There's, literal garbage in the food, but there's also garbage dietary recommendations, right?
Good at commitment, I'm just saying.
Well, and let's call that our Southern heritage as well, right? Let's just face it, we're fat and happy down here.
Speak for yourself.
I got a few pounds to lose, but I will say this. As a medical practitioner, I was given, I don't know about your schooling, I was given maybe 5 hours of dedicated nutritional education.
Have you met a nurse? We're like the most unhealthiest people. We don't get nutrition in nursing school.
Well, and I wouldn't even call...
I'm just lucky to stay alive, okay? That's it.
I wouldn't even call the education that I got in PA school good.
Real diet? I'm just kidding.
Right?
That's what I lived on. I'm kidding. Just kidding.
I don't think any medical professional gets quality, sound dietary counseling or education during their schooling. So it's up to them really to
take it upon themselves.
Yeah, to educate themselves on. And then, well, where do you turn? Where do you get the education that's actually relevant and good knowledge? Because there's so much crap out there.
Yeah, I didn't know what ketosis meant for like the longest time.
Nice.
I'm not gonna lie.
Nice.
I care.
So here's what I say all of that to say this. When I'm consulting a patient on diet, I'm like, look, you're going to have to do some research on your own. You're going to have to look into this a little bit, because why would you just take my word for it? Right? I mean, I got the white coat and I've done some training and I got some letters behind my name. Yeah. But you and I have about the exact same amount of dietary education. So what I will say is, whether you agree with being a vegan or a carnivore or anything in between, inflammation is the root cause of all evil. Inflammation leads to chronic disease. Inflammation leads to cancer. Inflammation leads to a bigger waistline.
Bad skin.
All of the things, right? Poor cognition. Thyroid issues, hormone issues, you name it. It all starts with inflammation. Well, Arden, what causes inflammation? All the crap food that you eat, right? So if you're eating food that's going to spike blood sugar, which is, simple carbohydrates or stuff that's processed or, in a box or a can, has preservatives, has food colors, it's going to develop inflammation. So whatever you decide to eat the cleanest, most holistic version of that. If it has an ingredient in it with a word you can't pronounce, then avoid it. If it comes in a box or a can, avoid it. If it has more than a gram or 2 of sugar in it, avoid it. And even look, I get it. It's hard to do. I try to
It's all about balance too. No one's going to be perfect, but
and it's not about perfection, but if we're trying
to you if you can.
If we're trying to develop a mindset here, ideally you're getting under 10 grams of sugar every day. Go ahead and try to find something in the gas station with under 10 grams of sugar, right? Unless it's a bottle of water, that's really hard to do. So you just have to be mindful of that. And it's like you said, we're going to have times where you're going to have a piece of birthday cake, or you're going to have some king cake.
Yeah, don't deprive yourself. Then you're just binging. Then you'll just literally
Right. The deprivation will lead you back to that legalism attitude, will lead you back to a yo-yo type.
You want what
situation.
You have type thing,
Yeah. But go ahead and have that piece, but cut it a third of the size of what you normally would, or just have 2 bites and then put it down. Whatever. Soapbox. Sorry.
All right. So we talked about fatigue as a side effect. Let's talk about nausea, GI.
Yeah, I can't talk about this so much because I didn't have any of it.
So I don't know
I lost
month I was on it. I was definitely wanting to give up.
So everyone is different. My personal experience with it was I never threw up, but I would just be queasy.
Yeah.
Like unsettled. Yeah.
That's a fun word, queasy.
Queasy. And like my blood sugar was low, which makes sense.
Exactly.
But that's kind of how I felt. So I could function through it. It was a queasiness I could at least function through. And that was at a very small dose too. I can't tolerate even like a mid dose.
Wait.
No, Arden.
Can we tell them the story?
No. So
no, I want to hear it now.
Tell them the story.
Let me finish my thoughts. So we
Go ahead.
off on tangent.
Finish your thought.
But some people might experience heartburn, indigestion.
That was a bad one for
constipation, diarrhea. All across the board, and there's really no rhyme or reason to what you're gonna feel. I haven't seen a trend.
Yeah,
No.
seen it either.
So yeah,
I will say
people that don't have anything, and then where I was like 0.25.
some people don't get any.
the only trend I've seen is GI symptoms will increase if they're eating bad. If they're eating poorly, like hyper-processed, hyper-palatable foods, their symptoms will increase. Anyway, go ahead.
Oh, now I want a story.
Oh, I got
Wait. If you do experience GI symptoms, we have the reboot bag, the IV bag that has Zofran. So
Or we can call it some Zofran. B12 does help with that too.
Yep.
We have tools in our toolbox.
We do.
Good thing about coming to see us weekly. We can, make you feel
We can really walk people through this process and
really
make it as comfortable as possible.
and help them get the results that they're looking for.
Yeah.
And they become family because I know my weekly people get very concerned when they don't come. Yep. So.
All right, it's story time.
Yes.
I gotta let you in on this. You're gonna love this.
I can't believe y'all kept this for me this long.
This is good. So this was a long time ago now. before we ever started thinking about offering medical weight loss and Rediscover Aesthetics.
And we had the pen, the click pen,
So
which is pre-dosed.
I met our local Ozempic rep. She's a gem. She's a patient, a wonderful woman, right? And we got a couple of samples before things got crazy.
Yeah, those were the good old days.
Yeah, right. So we're doing our thing, and Katherine had her mild symptoms, and I had no symptoms, but we're going about it. And I guess this was about 8 or 10 weeks in. Katherine was done, and she's been off the medicine for a couple of weeks, let's say, maybe 3 weeks. One day, she was like, you know what? I was off the wagon. I'm going to get back on it, do my thing.
I need a little booster.
She went to the refrigerator because the Ozempic had to be kept in the fridge. Went to the fridge and grabbed it. And she's like, do. I'm just going to twist the thing. Twist.
So let's hit.
This had a little, like a twist clicking
Where
device.
education plays a huge part in it.
And she was just like cranking it, maxed it out.
I didn't max it out. I just clicked till I saw the first number.
Well, what she didn't realize was that this was the higher dose pen.
It was a different concentration. It was Arden's concentration.
So Ozempic has 2 types of pens, right? And the first one has the little clickers up to, 0.25 or 0.5 or whatever. Well, this one, I think the first one was, 1.5 or something.
It's dosage.
Yeah. So she 5x'd her dose.
I did not have a good.
And let me tell you, this woman, it was like she was pregnant, and it was like morning sickness.
I never felt that bad being pregnant.
Your girl lived.
Girl's the example of why we don't do this.
She was not happy.
I was laying in the fetal position Christmas morning on the sofa.
Your girl was struggling. Struggle bus.
Yeah.
When we tell you why we're monitoring your dosage for the first until we get to know you.
We had IV.
Look.
I'd have been, I don't know. I would have gone to work and been like, help me.
Look, she was scraping our bathroom like a crack addict, looking for Zofran or looking for something.
Yes.
Right. But she looked like Dave Chappelle. Like, yeah.
Oh, shush it.
She was struggling, man. It was an amazing.
I survived.
Barely.
Barely. But this is why people end up in really bad. I mean, we're joking.
We are. Like,
yeah.
I mean,
because they went from 0 to 2.5 a week.
And this is why, like I said, education, yes, we do have the, ability to send it home with you now, luckily. But I wouldn't even, I'd do a minimum, they have to see us for 3 months or something before I have to know that you're accountable. You're not, you're going to be, you're properly educated with it. And then I trust you. We have that trusting relationship with it before I would even say, hey, yeah, I feel comfortable with you sending it.
Yeah, it's a case-by-case thing for me, but all the criteria like you just said, that's going through my mind.
Yeah, and don't think that just because you increase your dose that you're going to lose more weight, too. I think that's another thing people think. Just like Botox, the more you get, the longer it lasts. Well, it's not like that for semaglutide. Kind of like Tylenol, the more you take doesn't mean it's going to make your headache go away quicker.
It might make your liver shut down, though.
Then you turn yellow.
Ugh, yeah, that's a whole nother topic.
Yeah, that's whatever. But, you got some people that really do think that, so.
Yep.
Hey.
What other myths do we need to dispel about this wonderful medication?
Where's my sheet?
Well, let's talk about.
I made this grand sheet. Come on.
Let's talk about the other benefits of semaglutide besides weight loss.
Oh, yeah.
Go for it.
Recent studies have shown, Arden, talk about the because you talk the best about it, the anti-inflammatory effects and how it's working on addiction and stuff like that.
Well, I do know.
Gut health.
I really do think semaglutide can be used. It can win a Nobel Prize, I think. Addiction centers are using semaglutide to help with smoking cessation and help with alcohol withdrawal symptoms. And that goes back to talking about how it curbs the addictive nature of foods, where you almost become apathetic to the foods that you're eating. So I tell folks, hey, if there are foods that you should be eating but don't like it, well, now's the time, because you're probably not going to really care about what you're eating in a good way, right? Some people really like the way they feel with that, and some people get a little weirded out with it. But to me, I find that it's incredibly beneficial when I'm not especially if I'm stressed out or if I had a long day, like I'm not looking for an entire sleeve of Oreos or, yeah. Ask Catherine about those mint Oreos that she has to hide from the kids.
They found my spot.
Did they?
Mad about that, yes.
Man.
Knew both of my spots.
Well, that's a problem.
It is a problem. I'm going to have to find a new one.
Catherine used to hide sweets around the house to make sure that the children didn't eat them because the children they're savages.
Yeah.
Dude, my husband is like literally.
Yeah, I'm not hiding.
Come on.
I'm not hiding food because I have a problem. I'm hiding food so my kids don't eat.
The label that sucker like infected with, the flu or something so that people don't touch it. Yeah. Nothing makes me madder when I want something so bad and then you can't have it when you get someone ate it. So that's like homicide. Like right there.
Yeah.
That's just,
Yeah. Ooh. Oh, you know what? I didn't really drink much alcohol when I was on semaglutide.
Right. Because you don't feel that urge to drink.
No, I didn't really want to.
what a shame. I'm just kidding.
And I didn't think about it at the time, but then afterwards they're like, did you drink on it? And I was like, you know what? Now that I think about it, I don't think I really did.
I wonder if do you get drunker quicker?
Yes.
On semaglutide?
I've heard people say that, like that they can't
Elaborate.
Because, well, you're not eating as much.
they don't have that
So, yeah. And
cushion.
I get drunk really fast on an empty stomach. We all know that.
Me
So when my stomach isn't full, watch out. That did happen to me.
Is
many
that?
times.
Yes. We don't need to go into that either.
We won't go into that. We'll leave that one. Okay.
Yes.
Now that you mention it, Catherine, yes, you were correct. Okay. Well, good. Well, I'm glad we've talked about these things.
Yeah.
What else do y'all want to say about semaglutide before my IV runs out and I have to go to the bathroom? Yeah, you are. I think I was winning in the beginning, but where this thing is, I think I clipped it off a few times.
It's a new year. New you.
Oh, here we go.
What?
Hashtag New Year, New You.
Yeah. So come see us for your
Solution.
I like that one.
Like a resolution. No solution.
come see us for your semaglutide weight loss consult. Start the new year off right. Get a Franco's membership.
And then keep it off. Right. I mean, make this the last New Year's resolution that you have to make regarding your weight, because like we're not in it for a quick fix. We're in this to change habits. We're in this to change lives.
We're going to motivate you through, support you through it. I mean, like we're your biggest fans, your coaches through it. I mean, that's what I really love about our program is just like being able to, see them weekly, come in, see the progress, get to know them on a personal basis. There's some of my patients, there's nothing that would surprise me if they tell me now. Like that's how close we've got.
Like a little therapy session.
Every session. So I'm like, you mind out the window.
Yeah. Think of semaglutide as like
Family.
your little fluffy cloud, right? And your little fluffy cloud, it's carrying you from one place to another. But then we're going to prepare you to step off the baby cloud.
And then too, like going back to our tools in our toolbox, like if we're not getting the results that you want, or we're not seeing, you progress as we think you should, we have options. We have, we offer the B12, but we also have like the MIC injection now we can swap out with. We're about to, hopefully, here soon, implement, or with our hormone therapy, and maybe we need to run a hormone panel on you. See something else that's underlying that we don't know why you're not losing weight.
Yep.
Your thyroid, is it your, all that plays into part. And I think that's where we're really good at like being comprehensive and thorough with our stuff is we're not just sending you home with it to say, hey, figure it out. See you in 12 weeks. No, we're literally there to get
Yeah,
you
we're going
where
to walk you
need
through this.
be. And we're happy to be there, through that journey.
Well, thanks, ladies.
Thank you.
Anytime.
It's been a pleasure.
Let's do this again sometime.
Okay.
All right. Until next time, folks, this is the Aesthetic Agenda. I'm Arden.
I'm Amber.
And I'm Catherine.
See you later.
Bye.
Bye.